Thank you so much for joining us all. I'm always delighted to see familiar faces and new faces, and we just really appreciate your time. So thanks for joining us this morning. I'm Sabrina. I'm an appraisal pharmacist, and I've worked with AWTTC for 15 years. So I usually do a roundup of the last couple of months since we last met, but this time I decided I would do a roundup of the last year, because we have printed our annual report. So that's what I'm going to base my newsletter on this time. And I usually try and pick out the things that I think are meaningful for patients. But I have to say, you're my favorite group, because I think we get such practical, useful advice really from this group. And I often wonder how we capture it. So that's something, maybe if we do ever have a workshop, Claire, maybe we could think about how we feed this back in, because at the end of the day, you know, what we're looking at in our strategy is all about the improving the outcomes for medicines in various different ways. So I'm going to just give you a quick whistle stop tour from the annual report, and I will I'll put a link to that in the chat. But please have a look, because this group is really important in all of the tasks. From it's so varied when I look at it, but really the absolute outcome is overall the impact medicines have for patients. So you know, I know we are all patients, and but the conversations in this group are so helpful to inform what we do. So I know lots of you are really familiar, but the annual report starts with a little bit of who we are. So basically, you know, that is, I just wanted to re-emphasize that the overall rule of AWMSG and us in AWTTC, which support AWMSG, is basically just advise on which medicines should be available in Wales, in NHS Wales, and we try and ensure that those treatments are safe, effective, and good value. And this is something that evolves all the time. I was watching a program last night on sort of harms that had happened from medications from years ago. And so I think this is an area that evolves all the time. So yeah, safety, effectiveness, and that we're getting the best outcome for everybody in Wales. So the team that we work with for information is made up of clinicians, pharmacists, scientists, economists, lots of different people. And basically they look at the evidence and the analysis behind our decisions. So that was the start of the annual report. So then it moves on to our key achievements this year. So really one of the big things is access to medicines. And this is something we've had such success since I started in 2010, which is when we started to appraise all medicines. So this year we have recommended several new medicines that will improve care and quality of life. And also the one that I've recently been involved in was about access quickly. And that's something we really care about. So we've recommended several new medicines. We've also looked at access through innovative treatments through the Welsh Government's new treatment fund. We've also had some awards this year. Claire works very, very closely with the One Wales Medicines team, and they were recognised at the Moondance Cancer Awards. And they have really helped get patients access to promising drugs. And this is something that where we were repeating processes where patients had to apply individually for certain things, that we really tried to look for a once for Wales approach where we can make decisions quickly and we avoid people repeating the same sorts of decisions across Wales. So it was great to be rewarded for that work, and that work was recognised at the Moondance Cancer Awards. So then a big part of what we do is medicines optimization. And as I mentioned to Rob earlier, I am moving in to work with medicines optimization, having worked in medicines access for most of my time with AWTTC. So one of the things that we do is our national prescribing indicators. And these are basically a way of really looking at the things that we think are really important, that we actually set some guidelines for GPs to how these medicines should be used. And then we monitor them. So we've got an actual guide. We can really see differences in practice between different areas, different practices in GPs, and also that we set things that are really important. So we've updated those to what are the priorities that we really want to impact on prescribing. So we've updated those for the next 3 years from 2025 to 2028. And you know, this is an area I really love, because this is an area where we see change. These prescribing indicators set out good practice, either to use medicines that are the best choice, or sometimes to stop using ones that aren't the best choice. And they try and stop this difference where you have some practices that are a great practice, other one maybe there's a bit of variation. So I always find it really encouraging when we present some of these indicators where you actually see a real change in what's happening across Wales. So we've updated those. We've also looked at the guidelines that we produce, and we've looked at how we improve safe and effective use of medicines. So some of the guidelines we've produced over the year is reducing unnecessary antipsychotic use in dementia and tackling antimicrobial resistance. So again, this is one of the things I do often think about, how we use our patient organisations to promote these guidelines and to help for patients to know that these guidelines exist. This is a really important use. So yeah, antipsychotic use in dementia was one of the things, and particularly with antimicrobial resistance, we've done a lot of work on that this year. Environment sustainability is another area over the year that we've been working on, and again, another award. So we won the Welsh Pharmacy Award, and this is around, we've presented some of this work to PAPIG about reducing the carbon footprint of inhalers, and supporting the NHS decarbonisation strategy. And I know we've had lots of really good discussions about all of those leaflets that are printed in medicines that we can be on for 20 years, and we pick up these leaflets all the time. So great to see the work that's been done with reducing the carbon footprint with inhalers that we've worked on AWTTC. So that's an update on environmental stuff. The next thing just to let you know about is research and innovation. And I'm really proud to say that we've published 7 peer-reviewed papers. We presented at international conference and advanced data science, where we've monitored and improved medicines use. So it's great to be able to publish the work that we're doing, and to have, really, once that work's accepted in a peer-reviewed article, that that shows that the quality of the research that we're doing is worth sharing. So that's always nice to share. One of the things we mentioned before is that we've joined up with partners across the UK, and this is to look at where we know that there's a really new innovative medicine which can have a massive breakthrough. The licensing process, actually, it takes a long time. So this is about actually how we have new ways of working. So when we have these really innovative medicines that make a massive difference, that we try and get them available quicker. So we've been doing a lot of work. If you've met Tony, who works with us, he's been doing a lot of work on this, in actually joining up with others in the UK, so that for these sort of real breakthrough treatments, we're working at having new pathways so we get those available quicker. So we've done a lot of work in the UK with that. And then the next stage is working together. So obviously you're a huge part of the work that we try to do with patients, and really close collaboration with those stakeholders, with patients, families, clinicians and industry remains central to a lot of the work that we do. So that's one of the things that we reported back on in our annual report, the meetings that we've had, including our PAPIG meetings, because they inform all of what we do. And it's so important that the work that we're doing is informed by what's relevant to you as patients, what's relevant to you, to clinicians, and also what we're trying to do moving forward, and strategy in the next 10-20 years that we're planning that ahead. So thank you to the dedication of committees like PAPIG and all of the other people who have collaborated with us over the year to make the achievements possible. And then just to say, looking ahead, the things that we're looking ahead and have highlighted in our annual report is that really we're looking at a focus on value-based healthcare. And this is really broad ranging. And again, equitable access, that this is something we're really interested in that we have pockets of really good prescribing, but we really want to make sure that access is equitable across the whole of Wales, despite financial pressures. And this is something that we've we've always had a real emphasis on that we have access that's equitable for everyone. So we continue to address health inequalities, and we're really strengthening our data analytics. And I mean, and that's just fantastic, because we've got these dashboards which just give us such good information, and they're so visual, and they're just really helpful, I think, for clinicians to see how their practice can change, and they really support responsible prescribing to ensure that every pound spent really delivers sort of the maximum benefits for all of Wales. So I suppose our key message for patients to round all of that whistle-stop tour of the last year is that, you know, really what we're looking to do is quicker access to effective treatments. We really care about safer prescribing and, you know, smarter use of NHS resources. So we're, you know, putting a lot into the data, so we've got that information. So, you know, we're looking at today, and then also sort of thinking ahead over the strategy for the next 10, 20 years, that we're considering the future health of communities across Wales. So that's my update of our annual report. And yeah, I hope you'll have a look and, you know, let us know what you think is important to you, anything else you think we should include.